Good afternoon. My name is Monica Elliott. I'm co-president of the League of Women Voters of Broward County. The League of Women Voters is a nonpartisan political organization that encourages informed and active participation of citizens in government, works to increase understanding of major public policy issues, and influences public policy through education and advocacy. For more information, be sure to visit our website at lwvbroward.org. For today's webinar, we welcome a panel of experts to discuss how to identify red flags for suicidal thoughts and depression, as well as the many community resources available. We will have a question and answer session after the speakers, but feel free to type your questions into the chat box as we go. If your question is for a specific speaker, please be sure to state that. This session is being recorded, and we will upload it to our YouTube channel. We will then post the link on our league's website and also on our Facebook page. And we will also email the link to all the participants. And then from there, we ask that you share it widely so we get as much information out as to as many people as possible. So our first speaker for this afternoon will be Paul Jaquith. He's the CEO of Mental Health America of Southeast Florida. And Paul, it's all yours.
Okay, thank you, and welcome everyone this afternoon. Before we really get started, I just would like to remind people some of the information that the panel will be talking about and maybe questions may in fact be triggering to some people. And if so, you can make use of, you see in the middle of my screen, and I don't know what it looks like on your screen, but Billie Morgan, who is with 2 of 1, is on this line too. So just in case anyone is experiencing any issues, you can do that and call them and get resources. Some of what we'll talk about today will enlighten you on what some of the resources already are available within our community. I think someone raised their hand.
Yes, Paul, that was me. I think you need to increase your audio just a little bit.
Okay. Is that any better?
Yes.
Okay. All right. I'm sorry. But you were able to hear everything I just said because I'm not repeating it.
Yes, it just needed to be increased a bit.
Okay. Thank you. So my name is Paul Jaquith. I am the CEO of Mental Health America of Southeast Florida and Florida Initiative for Suicide Prevention. What I'm going to speak to you about very briefly is suicide prevention, but also introduce the concept of something called the LOST team, which is housed under us, which is local outreach to suicide survivors. Can you hear me okay? You can see. Let me just see if I can increase my volume here. Is that any better? Same. Might be time to get a new camera. I'll just try to speak loudly. So the last part of what I said is we also have a LOST team, which is local outreach to suicide survivors. We are the only LOST team in the state of Florida, as far as we know, and it's only available to residents of Broward County. So I will speak to that a little bit, and I'm going to try to put up on the screen a quick PowerPoint presentation, which lists who we are, and when we come upon a situation where there's a survivor. Survivor is an individual or a group of individuals who are left behind in the aftermath of a death by suicide. So there's a lot of questions that come up in the aftermath. We obviously know that a death by suicide is very traumatic. And traumatic for many people, and it does not just impact the immediate family. For every death by suicide, it can impact up to another 135 people. So we know there's a lot that there's a lot of people that could be impacted by the death, but we try to keep in mind that there's a lot of stigma still about death by suicide. And you notice I use the term death by suicide, not committed suicide. Committed suicide indicates there's a volition part of this, which there isn't. And probably through the course of our discussion today, you'll learn more about that. So part of what we try to do is just listen. We just listen to people. We just listen to where they're at with this and offer support and help wherever we can. We like to kind of use this as a guide for us in terms of what to say, what not to say. Like I said initially, we do not use the term committed suicide. We use the term died by suicide or death by suicide. We like to make sure that when we talk to people about the incident, we try not to get into too many details unless the individual wants to talk about it. One of my other roles in this community is I chair the Lethal Means Subcommittee. Half of all death by suicide nationally and locally are with a gun. And I know the league is very pro in terms of getting the word out about gun safety. We don't take a stand in terms of gun ownership, but we do take a stand. If you do own a gun, you should lock it up. If we can prevent someone from taking the steps and slowing down that progression of the steps to dying by suicide, we can sometimes stop that process and going to the ultimate step of dying by suicide. Guns obviously are very lethal means, so we try to get the word out about that. So some of these things, I'm not going to go through them all. You can see them on the screen. I don't want to spend a lot of time, but the bottom line is, less is more. Trying not to be going right in and saying, well, it's, they're in a better place now. How do we know that? We don't know that. We're making assumptions if we're saying things like that. So we really just try to listen to what people are saying, what the loss has been like for them. If you, for some reason, have a relative or you yourself have gone through this and you have people that you're talking to, here's some suggestions for what you can say. In working with people, we do all these things, but again, we try to really spend a lot of time just listening and not offering interpretations or anything in terms of trying to absolve the situation or making it easier for people other than just listening. The loss team.
I'm going to interrupt again. Are you sharing your screen?
Yeah, can you see it?
No.
Hold on 1 second. I've been sharing it all this time. I'm sorry.
Okay, I kind of finally figured this out. So
Let me do this. Here we go. Hold on. You see it now?
yes, it just needs to be put into slide or into show mode. Down in the lower right-hand corner of your slide, the next, one more. Yeah, click that. There you go.
All right, can you see that now?
Yes.
I apologize. I had no idea you couldn't see what I was seeing. I'm just going to put all these up. These are what to say, what not to say, which I briefly touched on. Really, I don't want to go through it because I kind of already did all that, but you can see it on the screen. These are things on the left side, really, that people are well-intentioned and well-meaning when they say these things, but they really are not helping people. You really got to understand that people, when we talk to survivors, they'll describe feeling like their feet are in cement. They don't know where to turn. They don't know what to do next. They really just frozen in a space and time. And what we try to do is offer opportunities for people to get the supports they need. Um, and that's really what the right side of the screen talks about. And here's some suggestions in terms of what people could say to people in the aftermath. Again, survivors are those people who are left behind in the aftermath of a death by suicide. Um, we also know that survivors are at a higher risk in terms of death by suicide themselves. So uh, we will offer to remove any firearms that are in the house if we can. Of course, we do that with the police department. Our team will go to the scene of a death and work with the police and the victim advocates at the scene and providing support and help to those family members. We also have an opportunity to kind of help people with some funeral expense costs, biohazard cleanup if needed, all the things that most people don't think about when they're faced with this situation. But we really wanted to reduce the length of time between when someone is first a survivor of this before they start seeking assistance. We want to shrink that time. It usually is about 3 to 4 years before people seek services. We try to shrink that down to 3 to 4 hours if we can, and get people connected to services. So we do evaluate people if they need more additional support. We'll connect them to local resources. Of course, we use 211 frequently for assistance with connecting people with services and so on. As I mentioned, guns are responsible for at least half of the deaths by suicide. And we work very closely with the league in terms of getting gun locks out to people. We have done an extensive campaign with local gun shops, target ranges, to get the word out to gun owners about the safety issue and what they can do to reduce the opportunities, if you will, for death by suicide with a gun, because a gun is a very highly lethal means. So we work with families, we work with the community to try to remove that. These are just some pictures from some of the remembrance events we do. It's very important that people have an opportunity to talk about their loved ones in a way that's a remembrance of them. What tends to happen is people, because of the shame and the stigma that's associated with the death by suicide, oftentimes don't feel they can talk about the person. And we feel just the opposite, that you should have that opportunity to talk about them, that they did live, they were with you, they were part of your family or your friend or whomever, that they had a life prior to this. And this does not define their life. So we do a lot of work with family members. This was an event we did at Butterfly World, and it was very symbolic. There's a lot of symbolism in all the work that we do, because each of the survivors got like a little caterpillar that in a little cup that they took home with them, and then it morphed into a butterfly. So the whole process of resurgence in life and so on was part of that work that we did with them. And then we did, I don't know, this was kind of a fun thing. We did this, I don't know if people have heard of this Wreck-It room, where you go and just, trash stuff. And when my team first came to me that they wanted to do this, I thought, I'm not that keen on this. But they did it. And the survivors who came to it found it to be extremely therapeutic. And I'll just share one story with you. There was a woman whose husband had died by suicide and suffered many, many years from alcoholism. He just never got into recovery. And she just went in and found beer bottles and broke beer bottles. And she said for the first time in about 8 years, she felt something, and she felt some relief from it, that she could at least take out that rage and that fury that she was feeling. And it gave her that opportunity. And of course, we do like follow-up groups with people and so on. This is our contacts. If you need the information, I can share it with our hosts here that you can utilize that. But these numbers and emails are available to contact the lost team directly. They get a lot of calls. I mean, I guess the good news, if there's good news, is I'm going to start sharing this. Okay. All right. That the rates of death by suicide in Broward County actually, I think, fell this past year. Not dramatically, but they're down a little bit. We also know that the method of death by suicide had also dropped in terms of guns. That there was a reasonably significant drop in that. So we're hopeful that we're getting the message out in cooperation with so many other stakeholders, many of whom are represented on this panel, to get that word out about locking up the guns, because it just slows the whole process down. I really wanted to talk more about that loss team because I know the other speakers will talk more about the prevention parts, but this is a postvention, what we call postvention, meaning it's in the aftermath. So a lot of people don't know that service is now available. It's only been around for about 18 months, but it is available, and it does not have to be a recent death. It could be someone that died 5 years ago. It doesn't matter. We have survivor support groups that we do both virtually and in person that are available to anyone. They don't have to be from Broward County. They can dial into those meetings. They are held weekly with other survivors. What we try to do is match survivors, with people who have had similar losses. So if someone lost a child, we try to match them with other parents who've lost children, adult or younger children. Or a spouse, we try to match them because there's sometimes differences in terms of what that loss is like for them. So it is a service that's available, and I thought that people would be kind of interested in hearing more about that. So I'm going to cut off my presentations and move on to the next one. Thank you.
Okay, thank you very much, Paul. So moving right along into the 211 that he mentioned, we have Billie Morgan. She is Director, Training and Staff Development at 211 Broward. Billie, it's all yours.
All right, well, thank you. And thank you, Paul, for sharing. And all of our experts here are doing amazing work out there. So what I do here at 211, I'm Billie, I'm the Director for Training and Staff Development, is that I'm here to connect the dots. That's what we do at 211. We represent 988 as well. I'm going to spotlight myself, but also I want to have an opportunity to share a couple of things about what 211 does. So come along with me and learn together. I think many of you know about 211 and what we do. And we're their first call for help. Now, Paul had a powerful statement there to say all the things that, we need to do about prevention. And when you think of 211, you might think of one thing or another thing, but we're there for everyone. Survivors, people thinking about suicide, for basic needs and everything else under the sun. So quickly, before I talk about some warning signs about suicide, because suicide prevention is really what we're here for, and awareness of that is the work of 211. We are 24 hours a day. We never close. We're confidential and anonymous. The caveat to that is if that person's going to hurt themselves, we have a duty to protect that person and keep that person safe. But we really do hold that value of the confidentiality and anonymity. Really, it's important for us. Supportive listening is a lot of the work that we do. Information, referral, assessment, advocacy, everything under the sun. The most important work is the one for crisis intervention. And like I said, it's not just for me. And hopefully you can see my screen. And just speak up if not. I just want to remind you that we are highly trained. We speak all languages, 241 we can have access to. And we are empathic listeners. We empower, we advocate. If you're just having a tough day, this is a number you call. If you're needing the number for the local library, this is also the number to call. So it's everything under the sun. We're just right there at your fingertips. You can text us. You can, there's different ways to access us, and I will talk more about that. But I really want to get to the work of what we do. Now, in the past, it used to be that somebody was having a need. They lost their job, or they're thinking of suicide. They need to find childcare, and before they would go from this agency to that agency and not be able to access what they needed. And now we simplify that. So it is the number to call when you don't know the number to call. We can do prevention, suicide intervention, and all of those services. And we have peers as well to be able to talk about mental health or those who might be struggling. Who calls us? Everyone here in our community and beyond. 211 is a national number. You can access it in almost, I think, 98% of the nation, Canada, Puerto Rico as well. You can reach out and connect to a 211 provider. And we're the 988 and suicide prevention area, serving that area. So you could see, you might connect with one or more of these images. So I just want you to realize that we are here for everybody in every need, and we do what we can to help every person and advocate and offer support. And I would be remiss if I didn't mention our funders out there that keep our doors open. We're a nonprofit organization, and you could see all of our funders that are listed here, as well as municipalities and individual donors and partners, and everybody, we thank them. And I'm not going to get into programs and services because I only have a few minutes here, and I really want to talk about where the rubber meets the road about suicide prevention. So I just wanted to highlight a few of the many programs that we offer, and services, by the way, are my favorite price. They're 100% free, everybody. So it's incumbent on us to be able to tell our community about this resource. If you are struggling or know somebody who's struggling with behavioral health or beyond, this is the number. And you know what? Don't just say, hey, call 211 or call 988. You should say, hey, let's make a call together, because that's going to make all the difference to show that you care. And if you know somebody who is struggling, make a call with them. And we're here to receive that. Our amazing counselors here to be able to support that person with the resources they need or intervention that they need. And often, if you don't know, suicide and substance use kind of go hand in hand in some ways. And the other one I want to also mention for programs and services, and I know we have a representative from the VA here as well, is that we do have services and resources for those who have served our country. So remember to link up to us about how to access services for veterans. And we know there's statistics there that we'll hear about. And another at-risk group to mention is our seniors who live alone, especially. And we have a free service called Touchline for seniors 55 and older that live in Broward County alone. This is a great number or a great way to share that. And it's a daily reassurance call. It saves lives regularly with that daily call that we at 211 provide to our community. And again, my favorite price, it's free. So I'm going to get off my soapbox about how awesome 211 is. But I also want to mention the work that we do for the crisis line. We, as you might know, everyone knows 911 for emergencies. And now I hope that you already knew about 211 before you came in today, but help spread the word. But another one is our mental health services for substance use, suicide crisis 988. You can always call us at 211. We'll be able to provide that. But with 988 out there, you can be a support for somebody who is struggling. So it's an easy to remember number, and it's a way to access those services. And we're that affiliate here. And now I don't know if you remember 1-800-273-TALK. I have it right always at the top of my mind. But you can either dial that number if that's what you have, but 988, it makes it simple. And just that's, something that's really been revolutionary. We have seen an increase in calls because of the access to 988. And please share the number 988 if you know somebody who's struggling. So when we're talking about struggling, we're talking about mental health today. I just wanted to share a quick visual about some warning signs for suicide, and you could look at those on your own. But we handle these calls at our agency. We're here to support somebody, be non-judgmental, a platform for them to just be heard. And every day, multiple times a day, day and night, 24 hours a day, we're handling those heavy calls and helping that person find hope and help. And when there is no hope, there are callers who are struggling, and we cannot get them to stay safe. Then we can help that person collaboratively create a safety plan, get interventions through our partners like Henderson Behavioral Health or 911 if it's needed, depending on the nature of the call. So we are the experts in that area to be able to keep that person safe through our counselors that are amazing out there. So you could see here that these are things, if you know somebody or if you yourself might be feeling these warning signs, reach out. We can help you maybe find some coping skills. So if you have somebody, as you can read, see giving away, there's a substance use, negative views of self, that hopelessness and helplessness. By the way, and I know Paul has emphasized this, it's okay to say suicide. It's okay to ask, are you having thoughts of suicide? And what if they are? You have us. you can say, you know what, I'm concerned. Let's make a call to 988. Now, you might not feel comfortable asking that. We have plenty of callers who say, I got a text from a friend and he's saying goodbye world and I don't know what to do. Our counselors will be able to give you some resources, help you, and offer to make a call to that person you're concerned about. And it's really important for that person to know, if you're able to say, hey, Martha's concerned about you. And, you know, she wants to check in with you. And she asked us to give you a call. So I wanted you to kind of know the steps. There's 5 steps. And hopefully I can share my sound here and make sure everything is, yep, here we go. Let's watch this short video about knowing the steps on suicide prevention, provided to us through our partner. And you'll probably hear a familiar voice here. So let's take a listen.
Hi, I'm Nick Offerman. Thanks for joining me and the good folks at the National Suicide Prevention Lifeline. Most of us would take action if we knew someone close to us was thinking about suicide, but many of us don't know what to do. Here are 5 steps to take to be the one to help save a life. Warning signs of a suicidal crisis include extreme changes in mood, sleeping habits, and increased drug or alcohol use. Someone might talk about feeling hopeless or like a burden to others. If you notice these signs, ask directly, are you thinking about suicide? Studies show that asking about suicide does not increase suicidal thoughts or actions. Being there means helping a person in crisis feel less alone. Be present and calm. Try not to judge. Listen to their reasons for being in pain and help them focus on reasons for living. If you can't be there in person, connect by phone, text, or video. Keeping someone safe means putting time and distance between them and any means they could use to hurt themselves. Work with them to remove dangerous objects or offer to hold on to them until the crisis has passed. Ask, do you have a plan to harm yourself? What's the timing? How would you do this? When lethal means are made less available, suicide rates by that method decline. Help someone with thoughts of suicide connect with others and support resources. Develop a safety plan together with ways to recognize when they are in a crisis, actions they can take if they feel desperate or overwhelmed, and individuals and services to contact when a crisis occurs. After taking these 4 steps, visit, call, or text in the days and weeks to come. Ask, how are you today? Is there anything you need? Even simply reaching out is proven to help reduce the risk for suicide. When someone we know is struggling to cope, we can ask, be there, keep them safe, help them connect, and follow up. These 5 actions can help not only prevent suicides, but also build a more connected and compassionate world.
Thank you, guys. And remember, and I'm going to share one more thing here. Ask, be there, connect. These are all so important for the work that we do. And we might not be asking you to be that person to provide the intervention, but it's critical that you are there to be able to support that person. And just giving the number might not be enough, right? So we want to just make sure you know this is one place of many that you can call, but that connection is so critical. So what are we going to talk about in the last couple of minutes that I have is just where to find that. Where can we find that information? So I will show you, my one last couple of slides here. Let's get to that from current, and I'll show you, hopefully I can get you to see this slide. There you go. And it's just want you to know that this is a number. As long as you know there's a number, 988 or 211. I also need you to know that you can call us, text us, chat with us, email us. There is no stopping you from accessing the amazing services of our helpline. And the resources are there in our database. And the last thing I'll say, speaking of resources, is these are some community resources and supports we have. Some of the logos you recognize, some of them, actually are here today. And you don't have to remember any of this information because it's all centralized with 211. You can call us, get that help, reach out for support, don't hesitate. And you can also visit our website and collect the agencies that help with mental health or whatever the situation might be. So reach out and connect just for youth, adults, everybody in between from birth to earth. We are here to be able to give you that resource. And you can visit our database, chat with us there. If you're not comfortable reaching out for support just over the phone, there's no reason why you couldn't reach out to us and connect with us. The last thing I'll leave you with is that we actually have an app, and there are some great mental health resources on there as well. All right, so please just look up 211 Broward and the App Store. You should be able to find it. And one challenge I'll leave you with is reach out to others, reach out to the community and beyond. Please tell people you're the little red person there. If you can just tell somebody about 988 or 211, we could potentially save more lives. So get people to connect to this resource, to the support. And just get connected, get help. You can see all the ways that you can do that. It's with a phone call, a text, a chat. So I just want to say thank you for that opportunity. And also, I just want to send my appreciation to you all. And I think we're sticking around for questions at the end. And one of the things we do for self-care, by the way, care for yourself, is at 2:11, we usually do a stretch. So we can do it early because it'll be somebody else's presentation. So if you want to do a stretch, feel free. Our helpline counselors always at 2:11 do a little stretch for their own self-care and to wake themselves up. So I appreciate that and appreciate you reaching out whenever you need us. We're here for you. Thanks for your time.
Thank you very much, Billie. That was
My
great.
pleasure.
Okay, I don't see where Simone Edwards has come in yet, so we will go ahead with our next speaker, who is Tonia Summers.
I'm here.
Oh,
I'm here.
Oh, okay. Sorry, didn't see the little square. Okay. So we will continue on then with Simone Edwards. She is Suicide Prevention Coordinator at the William Bill King VA Clinic in Broward County. It's all yours, Simone.
Perfect. Thank you. Can you hear me okay?
Yes, I can.
Perfect. Perfect. Hello, everyone. So I'm sure to announce Dr. Lewis couldn't be with us today because of an emergency, but I stepped in. So hopefully I was praying I was not the one following Billie, but here I go. I will talk to you after, Barbara, about this. But thank you very much. So I work with the Miami VA system as a suicide prevention coordinator. I've been doing that for about 15 years now. My home base is our Broward Clinic, the William Bill Clinic, which is based on Commercial Boulevard and Nob Hill Road. That's our largest Broward clinic. But in Miami actually covers from Key West all the way to Deerfield Beach. So we do have a couple of other Broward-based clinics. We have a clinic in Hollywood, which is near to Memorial South. We have a clinic in Pembroke Pines off Sheridan Boulevard, which is actually near to the Memorial Hospital there, Memorial Pembroke. And then we also have another clinic, a small clinic in Deerfield Beach off 10th Street. So just to have an idea for us here in the Miami VA, as everyone, I know people probably have heard before, people would say 22 veterans a day. There was a movement once called 22 a day. The VA has done a lot of research on veteran death by suicides. And over the years, we've found, through outreach, through clinical efforts, that we've been seeing a decrease. So that's actually the last number we had was 2020. We're still doing more research to see our more current numbers. The last number we had was 16 a day. But our thinking is any veteran a day is too much. Any death by suicide. I mean, I'm talking from the veteran perspective, but any death by suicide is too much. And as everyone here has shared before, everyone's goal is to see that decrease, and our goal is zero suicide. We feel that no one should have to suffer alone, and no one should have to die like that. So here at the VA, we started our suicide prevention program about 16 years ago. And the initiative of the VA was to hire a suicide prevention coordinator at every VA. And we also partnered with the National Suicide Prevention Hotline and created what we called, at the time was the National Veterans Suicide Prevention Hotline, which is now called the Veterans Crisis Line. That is actually part of the 988 number that Billie spoke about. So if you're out there and you're a veteran or a loved one of a veteran, usually we ask you to press 1, and that call gets routed to a separate call center that's run by clinicians hired there through the VA. That call center is particularly good because it's linked to every VA across the country. So to give you an idea of that resource, you call the number, they find out where you are, they send information to the nearest VA for someone through mental health, usually through the suicide prevention team, to reach out to you within 24 hours. If there needs to be a dispatch done, a dispatch is done, through 911. If you just need some sort of follow-up, whether it's connection to mental health care, whether it's a listening ear, whatever it is, they send it to the local VA. Someone from that team reaches out to you and calls you within 24 hours. To give you an idea, since we partnered with the National Suicide Prevention Hotline in 2007, our portion of that press one, has received over 6 million calls. And we've had close to 250,000 dispatches that have been done. And like Billie said, since 988, that was just with the 1-800 number. Since 988, we too have seen an increase, but that's what we want. And actually about 2011, we rebranded. Instead of calling it the Veteran Suicide Prevention Hotline, we called it the Veterans Crisis Line, because we wanted people to know we don't want it to get to the point of when you have suicidal thoughts. Anything, any sort of crisis is worthy of reaching out. Like Billie said, I'm going to use her word, reach out and connect. And that is something that we have been pushing also, is having everyone know anything that you feel. If you feel something isn't right, if you just feel you want to talk to someone, we don't want it to get to the point where you feel that, okay, it's a suicide prevention hotline, I'm going to wait. We want you to reach out and call. And that's one of the reasons why we changed it to the Veterans Crisis Line. And it was funny, when we rebranded it Veterans Crisis Line, we saw an increase in calls. And now with 988, we've definitely seen an increase in calls and people reaching out for help. So that's part of the efforts that the VA has done. The other part is us working along with veterans who've been deemed in crisis, veterans who've been deemed high risk for suicide, whether it's somebody who was recently hospitalized, whether it's someone who, when they met with their provider, they were showing signs with the risk factors that Billie showed you a picture of before. So I won't go over all of that. And maybe the doctor just felt they needed some extra support. They reach out to someone from our suicide prevention team, which in Miami, we have 10 of us that work to cover all the different clinics. So we reach out, we follow that veteran, we make sure they're coming to their appointments. We reach out with phone calls. To give you an idea, the Miami VA system itself has several different levels of care. We have a 24 ER, so our veterans can go there anytime. 24 ER with a psychiatrist on call 24 hours. We have at the actual hospital, an inpatient unit where you can be admitted. If you need to be stabilized, you can be there for the short term. We have outpatient programs from Key West to Deerfield. All of our clinics, no matter how big or small, have at the very least primary care services, psychiatric services, and social workers on site. Even with COVID, yes, we do have people on site still. We try to make sure that that coverage is there. Actually, at our Broward clinic, we remained open all throughout COVID, a little bit more strict with who could come in and out, but we still had our walk-in for anyone who needed medical or mental health services same day. So we do have that level of care, and we also have residential program. Not every VA is able to offer that. We actually have residential programs through our Miami VA where if you have substance use, you can go to our program. It's about 3 months. If you have PTSD, we have a separate PTSD program. And if you just need a general psychosocial rehab, whether it's anxiety, depression, we have a separate program for that. So we're very fortunate to have that because, as I said, not every VA has residential programs on site. And here in Broward, at the Broward Clinic, since that's our largest, we actually have our substance use outpatient program in addition to regular psychiatric care. We have our PTSD program there also, and we have a walk-in. So if you have a veteran or if you are a veteran and you need help and you need to see someone in mental health same day, you can come to our Broward Clinic as a walk-in. Monday to Friday from 8 to 3, there's a psychiatrist assigned to our walk-in clinic, a mental health social worker, and a mental health nurse. Because our goal is that we know that you hear everything about there's wait lists, there's this, there's that. But for us, that's why we want to push the information that there is same day access. You can see someone for mental health same day, and actually the same for primary care. Our primary care clinic has a walk-in because I don't know if anyone touched on it before, but when you look at mental health, it's not just us looking at this part. It's us looking at the whole body, So sometimes we miss out on the physical. You know, how does the physical and the medical affect our mental health and vice versa? So actually access to primary care is key too. So we have same-day access to primary care at our clinic. So I just wanted to at least let you know the services that are here, the services that are available in Broward. My main takeaway for you is to know that if you're a veteran, or if you are a loved one of a veteran and they're in need, there is care, there is service, there is support. We are here for you. 24 care in Miami, but if you're in Broward, and I know driving to Miami does not sound great, we have our same-day access clinic. And a separate little program that was started earlier this year is called the Compact Act. I don't know how many of you have heard of it, but the Compact Act was approved in that it will cover any veteran in crisis going into a local ER for that care. If you go in, it's specific to suicidal crisis. So especially for Broward, I follow that a lot because a lot of our vets are not going to go down to Miami if they're in crisis. So if you go to a local hospital or you're in crisis and you let them know you're a veteran, they reach out to the VA, they let us know you're there. So two things would happen. Either we try to transfer you, or at the very least, we know you're there, they make a note and we can cover that care for you. And it covers not just only for the inpatient care and the assessment, the Compact Act also looks to cover for outpatient care. There's a process to it, but it is there, it's active, it started this year. And we want to get the word out so that everyone in the community know that that's available also. So I don't want to be a time hog, so I'll be here for any questions, but I at least wanted to give the basic information of what we offer so that everyone knows what's out there. Thank you.
Thank you, Simone. Wonderful. So now we will move on to Tonia Summers, who is the Suicide Prevention Coordinator of Student Services with Broward County Public Schools. It's all yours, Tonia.
Thank you. Good afternoon, everybody. Thank you for the presenters who have gone before me. Paul, Billie, Simone, nice to see everybody. Nice to meet everybody. I'm going to be talking to you from the school perspective. I am one of 3 suicide prevention coordinators that were just hired a couple months ago for Broward County Public Schools. So I serve the Central Region, and my 2 teammates are actually online with me to support me, and my part of my other team, the North Region Coordinator is also here, and the Southern Region Coordinator is also here as well. So these 3 positions were created specifically to address just fully suicide prevention for Broward County Public Schools. So we're very, very excited to be able to have this opportunity to really just delve into and explore this very, very important topic. And just hearing the community resources that came before me, I've heard of them before, and I'm looking forward to working with you and continuing to work with you. So what we're doing as part of our initiative this year is, our biggest initiative is something called Thrive in 5. So we have identified the schools in a tiered approach based on Baker Acts, based on suicide risk assessments that have been done last year. And we're going into schools and we're working with them. You know, you see numbers on a paper, that's data, but you also need to go in and talk to the individuals that work there, the individuals that work with the school, and find out what the needs of those schools are. So we have made appointments with principals. We're currently meeting. We've identified about 60 schools, and I think we're just about done. Probably by the end of this week or next week, we'll be done meeting with schools, and we go in there, and there's services that our department offers. So we offer curriculum, suicide prevention curriculum, from elementary all the way up to high school. We do presentations for staff. We do presentations for parents. We have different presentations for students. We can connect them with life skills and resiliency training. So there's lots of things that we can do to help schools. And we don't, you know, just throw everything out there. We basically try to help schools identify what they need. And then based on what they need, we're able to help them provide those services so that they can be able to support the health and the wellness of their students. So that's kind of what we're doing as a targeted approach. And our strategy is really to just kind of help people identify those risk factors, those protective factors, and build that resilience in our students. students, because what we want to do is we're not going to be able to remove all adverse situations that happen in the lives of students. You know, we can do the best we can, but we're not going to be able to remove every single thing that might happen in a student's life. But what we can do is we can educate the adults and we can support the students as they work through, live through those experiences and give them those, you know, skills that they need to be able to be successful academically, but just moving forward in life. And we're also helping our staff kind of identify patterns that they might see in students so that they can support students and what to do and how to do it. So that's what we do. We're just going out there. We're trying to help support our students, trying to help support our staff. And we're excited to start this work and continue it on for this year and beyond. So thank you for having me.
Thank you, Tonia. Okay, next we will move on to Beth Wiegard, who is with Moms Demand Action for Gun Sense in America. Beth, it's all yours.
Great. Thank you so much, Monica. And I want to thank the League so much for hosting this important webinar today and for having me on. I'm Beth Wiegard. I'm a volunteer with the Broward group for Moms Demand Action for Gun Sense in America. We are the largest grassroots gun violence prevention organization in the US. We're fighting for public safety measures that can protect people from gun violence. We know that gun violence is preventable, and we're committed to doing what it takes to keep our communities safe. I'm going to talk a bit today about risk protection orders, or RPOs, in Florida. And I wanted to start with some context about the role of guns and death by suicide. A lot of people don't know the majority of gun deaths in the US are suicides, 57%. And as Paul said earlier, the majority of deaths by suicide involve a gun. Additionally, only 5% of suicide attempts end in death, but 95% of suicide attempts using a gun are fatal. So most people who survive one attempt don't make another, but people who attempt suicide with a firearm don't get that second chance. And the bottom line is easy access to a firearm can be the difference between life and death for people who are struggling. We also need to recognize how the pandemic made this problem worse. It's estimated that 22 million guns were purchased in 2020, a 64% increase over 2019. And there was also a recent study which showed some very concerning characteristics about the people who bought guns for the first time during COVID. 55% of those first-time firearm buyers had thoughts of suicide in the 2 weeks before the survey, compared to 10% of other gun owners and 6% of people who did not own a firearm. Also, 64% of those first-time buyers reported self-harm on purpose in the last 2 weeks, compared to 4% of the other two groups. First-time pandemic firearm buyers also reported much higher levels of mental health symptoms, including depression, anxiety, alcohol use, nicotine use, and antisocial behaviors than other gun owners or people who didn't own a firearm. But here in Florida, we do also have a valuable tool that we can use to temporarily remove those lethal means. It's called our law for risk protection orders, which is also known as Florida's red flag law. It was passed in 2018 with bipartisan support as part of the Marjorie Stoneman Douglas High School Public Safety Act, and was signed by Governor Rick Scott. It's designed to enhance public safety by restricting firearm and ammunition possession by a person who poses a danger to themselves or others. Since 2018, nearly 9,000 of these orders have been issued, nearly 800 of those in Broward County, saving thousands of lives. A review of available petitions shows that more than half were filed in response to reports of a person being suicidal. So here's how the process works. If a person knows someone who poses a danger to themselves or others, they contact their local police department or sheriff's office. So in Broward, that would either be BSO or your local police department if your city doesn't contract with BSO. Whoever contacts law enforcement needs to give them information about the person concerned, their mental health condition, any threats or acts of violence, any other factors that raise a concern for safety, and information about any firearms and ammunition that person has in their possession. Law enforcement then files a petition with a court asking for a risk protection order, which would allow for temporary removal of the firearms and ammunition from the person at risk. They have to provide sworn affidavits with evidence to the court about things like recent threats of violence, recurring mental health issues, history of violence, evidence of substance abuse, reckless handling of firearms. The court then holds a hearing, which the person concerned must be informed of. And if they issue a protection order, the person must immediately surrender all their firearms, ammunition, and any concealed carry license to law enforcement. Then that order can be in place for up to 12 months. Once it's issued, the respondent, who's the person concerned, can request a hearing to vacate it, but this time they have the burden of presenting the evidence as to why it should be vacated. And then law enforcement can also file a motion to extend the order at the end of the 12 months, and the court will have another hearing on that. So here's the key takeaways. Law enforcement petitions a court for an order. The court has a hearing and issues the order. Law enforcement removes the firearms and ammunition temporarily. The person has a chance to ask for the order to be overturned, and law enforcement has a chance to ask for the order to be extended. This is a powerful tool to protect vulnerable people by removing lethal means when they really shouldn't have access to them. But there's good news and there's bad news about the law. So the good news is the law is already in place. We already won that battle in the legislature. And as I said earlier, it's been used thousands of times to save lives. The bad news is there's a lack of awareness about what the law does and how the process works. Some people, if you talk to them about this, they will say they're against red flag laws, but if you ask them if they think it's a good idea to remove firearms temporarily from someone a court has ruled as a danger to themselves or others, they'll say yes. And then even people who do know about the law and want to start the process don't know how to take the first step. Part of the problem is under the statute, only law enforcement can file a petition with a court, but they have no responsibility to make the information about the process available online to the public. That's assigned to the Office of the State Courts Administrator, which I never heard of. So if you're concerned about someone, how are you supposed to know who to contact and what to do? Your first thought is probably not going to be to go to a state court website. Some people might be reaching out to mental health resources or crisis centers or law enforcement. We really need to make sure that information about ERPOs are being made available by those service providers and in any other spot where people might be reaching out for help if they're concerned about someone. Here's an example. I mentioned that there were almost 800 ERPOs issued in Broward County since the law was passed. However, Volusia County has had almost 700 issued, and their population is less than a third of ours. One big difference is that the Volusia County Sheriff has a whole page about ERPOs on their website, including a posted database of all the petitions that's filed and why. And guess what? More than half the petitions filed by the Volusia Sheriff were for suicidal persons. There is currently no mention of ERPOs anywhere on the BSO website or on most of the city websites in Broward. Moms Demand is working to change that, and we could actually use your help if anyone's interested in helping. I'm going to drop contact information in the chat at the end of my presentation. You can get in touch with Moms Demand. Another problem with the limitation that only law enforcement can file a petition is that some people may not want to involve law enforcement when they're concerned about somebody, or they may not have a relationship built on trust with the law enforcement presence in their community. Another problem is that some law enforcement officials in some parts of Florida claim incorrectly that ERPOs violate Second Amendment rights, and they resist filing petitions or removing weapons. Some states allow family members to petition the court directly for an ERPO, but currently not Florida. Bills have been introduced in Tallahassee to expand our law to let family members file as well, but those bills haven't been able to pass with our current legislature. So we're limited to law enforcement for now. That makes the awareness and outreach part even more important. There is a lot of good information about ERPOs on that Florida State Court website, which is where it's required to be by the statute, including a printable brochure, which I'm going to share a link for that in the chat. Please feel free to download that and distribute it wherever you think it would help. And then I'm also sharing the contact information for Moms Demand. So that's it for me. Thanks so much to the League for having me and all of these other amazing panelists being here to speak today. And Monica, I'm going to hand it back to you.
Okay, thank you. And you will put that into the chat, correct?
Yep.
So we will send that, be sure that we send out these links that are in the chat, or if you're in the audience, you can look at the chat and copy them yourself. So now we will move on to our final panelist, and that is Barbara Markley. She is co-chair of the Gun Violence Prevention Committee with the League of Women Voters here in Broward County. And she and Deborah Davis founded the Lock It Up program, which I have to say the League is very, very proud of. Barbara, it's all yours.
Oh, thank you. Well, thank you. First of all, thank you everyone for coming to our panel. I admire all of you. You all have such amazing information to give everyone. And I find that we've done this, I think, 5 years in a row, and every year I learn something new. I don't know how that's possible, but I keep learning new things from you guys. And I think we all learn from each other. And I imagine that, you know, Paul and Simone and Billie all know about the ERPOs as far as, you know, crisis situations. Sometimes that is the tool that's necessary. So I want to just give you an overview about suicide in the United States. From 1999 to 2019, the suicide rate in the US increased 33% across all sexes, races, and ethnicities. According to the CDC, that same year, more than 48,000 people died by suicide, which is one death every 11 minutes. A total of 1.7 million people made a suicide attempt in 2021, and 12 million adults had serious thoughts about suicide. So this is a widespread problem. I just want to say on a personal note, I did have a friend who took her life with a gun, and I knew she was depressed. This was years ago. I didn't know she owned a gun, and I wish I knew then what I know now as to what steps I should have taken to try to help her. This is kind of a shocking statistic, but developed countries have seen a decline in suicide rates, but the US is an outlier. Suicide rates have skyrocketed over the past 30 years. Here's just something. It says research shows that nearly half of people who die by suicide interact with the healthcare system in some way in the month before their death. So this gives the healthcare system a prime opportunity to intervene. And so what is happening with that is they're starting to do universal screening. So whenever anyone comes in for really anything, one of the questions is about self-harm and depression and how you're feeling. And that way, and I picked that up when we went to the presentation by the VA the other day, is that no matter what you're there for, I mean, you could be there for your diabetes, but they are going to ask you how you're feeling and what, you know, your mental state is. And that way you're going to catch things that maybe you wouldn't have caught otherwise. And that's a really positive thing. So last year, well, 2022, 26,993 Americans died by gun suicide. And that includes 3,100 young people and 4,400 veterans. And that number is an all-time high for gun suicides. So what can we talk about with gun suicides? The US has 12 times the number of gun suicides of any peer nation. Think about that. Why is that? Well, we have 400 million guns for 330 million people. That's 125 guns per person it's 125 guns per 100 people. I really need to get my facts straight here. So the problem is that every new gun is required to be sold with a gun lock. That is federal law. However, and it's true, it happens, they do get a gun lock with their gun. But 54% of gun owners report not locking up their guns. Now, there's many ways to lock your guns, and the main reason people give for buying guns is self-defense, you know, protect my family. There are ways to lock up your guns that are also that make them available to you in 3 seconds. I mean, there's safes that open with your thumbprint. There's safes that open like a cell phone, you know, punch in a number. There is no delay in reaching that gun, but you are protecting the other people in your house. Having an unlocked gun in your home raises the risk of, well, it doubles the risk of a homicide, it triples the risk of a suicide, and it quintuples the risk of a fatality in a domestic violence situation. So you're not making your family safer by having an unlocked gun in the home. 3/4 of the children that, even people who lock up their guns, they've surveyed kids who say they know how to get to that gun, they know how to unlock it. We even had that happen at a health fest affair. The woman was very proud of herself. She was standing there with her child saying, oh yes, my gun's locked up. And the kid said, I know where you keep the key, right in front of you. The woman's face went totally white. She was in shock. And so, you can't be safe enough. I mean, as far as children go, children's brains, their judgment, people's judgment doesn't really fully develop till they're 26. So people, you may not think your kid is suicidal, but even your honor student could come home, have a bad day, their girlfriend broke up with them, they got an F on the test, and everything is a huge deal, a huge crisis. And the problem with a gun is that 9 out of 10 people who attempt suicide never try again. But with a gun, as you said earlier, we do not get that second chance. So it is a permanent solution to a temporary crisis. Now, who is taking their life with guns? Elderly, I want to say elderly men over the age of 65 is like the number one, leading group who takes their life. However, that is changing. Over the past decade, youth firearm suicide rates have increased by 57%. And firearm suicide is on the rise, particularly among children of color. So every day, it says every day, 67 people die by firearm suicide, 2 of whom are under 18. And of course, 90% of the people who attempt suicide with a firearm don't survive. Okay, so where are we here? Children of color living in our nation's cities experience the greater increases in the rate of firearm suicide than those living in rural and suburban areas. And those kids, 80% of those kids are getting those guns from home. They're not locked up. They can't buy one. I mean, the other option is steal one out of a car, because that's a big problem. But those kids are getting them from home. So if you're locking up your guns, you're protecting kids, you're preventing suicide, and you're reducing crime. So what we have done, well, and also a number you might want to know is that 1.3 million guns on average is what's purchased in the United States. That's a lot of guns. So what we have done at the League, we have a gun violence prevention committee. What we used to do, what we still do, is we fight for good legislation. We fight against bad legislation. But it was starting to feel like whack-a-mole, because we would fight off bad legislation, and then 6 months later it would raise its ugly head, and we would get started again. And we said, this doesn't really feel like we're moving forward. So we heard about a woman actually a pediatrician in Bozeman, Montana, who was giving away free gun locks to families to get them to lock up their guns around their children. I reached out to her and I said, this is a great program. How are you doing this? She said, I'm getting the gun locks from the VA. And I said, okay, well, just between us, do they know that you're giving them to the kids? It's not a veteran. You're not like a doctor for veterans. And she said, no, they know. But they said that we're getting them out there, they're getting to veterans. So she actually helped. She was instrumental in connecting us with the VA, our favorite people, the VA. And we partnered with them in 2017. And they said, we agree 1 in 8 people in South Florida is veteran. And if you start getting these locks out into the community, they will reach veterans. And that was the beginning of the story of Lock It Up. Since then, we have partnered with over 200 organizations, including everyone on this call and everyone on my panel here. And we've distributed 35,000 gun locks through over 200 partners. And I have to say, we've also given almost 1,000 gun safety presentations, which includes tabling at events, for which I have another one tomorrow, Broward College Campus Safety Day. But I have to say that of all the people we've talked to in all these years, the one thing they all say is, I didn't know that most of the gun deaths, the majority of the gun deaths in this country are suicides. You're not going to see it on the news. What you're going to see on the news is scary stories, and then you're going to run out and buy a gun to protect yourself and protect your family. But they never talk about the suicides. We happen to be in Suicide Prevention Awareness Month, which is September, and we would like everyone to know that having a gun doesn't make your family safer, that locking up the gun, not having the gun in the house is really the best way to protect your family. But if you want to have a gun, having it, the ammunition separate, the guns separate, everything locked up. We recommend gun safes, but we do give out the cable gun locks, which the VA has generously provided us with. And those gun locks will protect a child. They will prevent someone who's thinking of taking their life. The decision to take one's life through suicide is impulsive. They have shown that the decision is made in less than an hour. I mean, a person could be depressed for 10 years, but the actual decision to take their life happens in less than an hour. Often the average is 20 minutes, but it's sometimes as little as 5 minutes. So if that gun is locked up, that impulse can pass, right? And then you can get them help. So what we have free gun locks, and as does the VA. Anyone who would like a free gun lock who resides in Dade or Broward can email that request to gloria.lewis, Lewis, @va.gov and ask for a free gun lock. You don't have to give a reason. They will mail a gun lock to your home. But the theory behind our program is that, I'm going to back up a little. Gun laws work. The 5 states with the strongest gun laws have the fewest gun deaths and the fewest suicides. The 5 states with the weakest gun laws have the most gun deaths. It is not rocket science. However, if you do not have strong gun laws, like in Florida, we do not have strong gun laws. They're not as bad as some, but they're not as good as others. The key is education, and we model our program after MAD's campaign against drunk driving. When MAD started their campaign against drunk driving, it was legal to drink and drive. It was socially acceptable. And people would even say, have one for the road. I swear to God, I remember that. So that shows you how old I am. But when they started, they were mocked. There were articles in the paper about how silly this was. And you know what? They hammered that message home for so many years that everyone knows you don't drink and drive, and friends don't let friends drive drunk. And now it is against the law. Hooray. So we feel that education is critical. I mean, and so when I give a speech to people and I say, look, there's 2 million people in Broward. I cannot talk to them all. I need each of you to be an ambassador for gun safety and take this message out with you that locked up guns are going to save lives. In fact, that's our tagline: protect children, prevent suicide, reduce crime, lock up your guns, save a life. And we found allies in the strangest places, but we have found many allies. What else was I going to tell you here? Let's see. Okay, yeah, I mean, as everyone said earlier, it's really important to recognize the signs of depression. But getting people help is critical, but the first thing really is to remove lethal means, because it is an impulsive decision. And if you don't remove the lethal means, you may not get the chance to get them the help. So what you do is, and I have called all of the local police, including BSO, and they have told us, because some people aren't comfortable like taking a gun out of someone's house. I don't want that gun in my house. So the police have said that they will temporarily hold firearms for people in crisis. And that's an important thing to know. I don't think they advertise it. I don't think it's on their website. But if you said to them, I need to store this gun, then they've said they will do it. And so what you do is you say, are you thinking of harming yourself? Thinking of taking your life? Let's get you safe. And you have to remove access to everything. I mean, people say remove access to lethal means, and then they do a study and find out people don't even know what lethal means or what exactly we're talking about. We're talking about pills, we're talking about prescriptions, we're talking about guns, especially guns. So we need to get those guns away from the people who could hurt themselves with that. And then as far as reaching out, it's amazing how little it takes sometimes to reach out to someone. There was a psychologist who did an informal experiment on his own, where he just sent all of his patients a postcard that said, I'm thinking about you, I hope you're doing all right. And one of his patients came over and said, your postcard saved my life. I mean, that day I was thinking of taking my life. Nobody cares if I'm dead or alive. And I got this postcard from you asking me how I was. And I know that Simone has told me that the VA now does that. They have a postcard program. They have all kinds of ways to reach out to people. And one other anecdote I read, there's a bridge in England where people tend to jump off that bridge, I guess. And this young 20-something girl went to take her life, and she changed her mind. And she went back and she put signs on the bridge that said, "You matter, your life matters, you are loved, this will pass." And a lot of people changed their mind just from a sign from a stranger. So it really sometimes doesn't take much to reach out and just say, "Hey, you okay? I'm thinking about you." You know, you just don't know the burdens people are carrying around with them. They may look like they're fine. I mean, they may not be fine at all. So I appreciate everyone here and everyone who listened, and we're going to share this link, and I hope that you will also share it with on your social media and with people you know, because there's amazing resources in this county and a lot of people are unaware of them. The 988 has been here for a year and a lot of people still don't know about that. And so thank you to everyone. Thank you to Monica for being our wonderful moderator. And we would like to take questions from anyone who has any questions. Thank you.
Thank you, Barbara. So you can put your questions in the chat, or if you raise your hand, we can do it that way also. And I will start it out. And my question is to Simone. You indicated that there's a residential program. By residential, do you mean it's here in Broward County, or do they have to leave the county for that residential program?
No, the program is actually at the main hospital at the Miami VA. We call it, we have our 5th floor of the hospital is divided into 3 sections, and each section is devoted to one of the residential programs. And it's about 3 months. So the veteran lives at the hospital on this unit, but unlike other units, they can come and go because it's residential. So they'll go home to their family on the weekend, everything. It runs just like a regular residential program. They have rules to follow. If they don't follow the rules, sometimes they get restricted, you know, just as with everything else. But it's actually based at the Miami VA.
Okay. So do we have any questions? I don't see anything in the chat yet.
I had a quick comment, if I could just make really quick one about what Barbara was saying. Just a quick thing, like Barbara was saying about who takes their lives by suicide, who's using a gun. I just wanted to remind everyone when dealing with our veterans, whether as a loved one or a professional, to remember our veterans are very comfortable with using weapons. They're trained to use weapons. And so for the veteran population, you see a high use of guns by the male veterans, but you also see by the female veterans. While in the civilian community, you would more see a male use a gun while the female would use an overdose or pills. But so just remember with female veterans, it's a little different. They more mirror our male veterans. They tend to feel very comfortable with a weapon. They know how to use it. So we do see higher rates of suicide for our female veterans using a weapon versus other means. So I just kind of wanted to put that out there also. And when Barbara was saying about what are lethal means, how to protect ourselves, this is not my idea. I listened to a doctor that shared at a town hall the other day, a Dr. Poland, and I have to say he said something that I thought was really good the way he said it. He said for lethal means you lock up every cabinet. So you're locking up the medicine cabinet, you're locking up the gun cabinet, and you're locking up the alcohol cabinet. So I thought that was a cute, quick way to kind of just, when you think of lethal means, he said lock up all the cabinets in the house. Those were 3 that he mentioned.
Okay. Barbara has a question for Tonia.
Yeah, hi, Tonia. So I know during June, the school board issued a resolution for Gun Violence Prevention Month. They also took 200 of our gun locks, which I was very excited about. And then they said that they would also put on their website that the VA email if anybody wanted to request a gun lock. And I didn't know if you were aware of that. That's my first question. And then my second question is, I know the programs you have for suicide prevention. Tell us more about like anti-bullying. Like how does that play into the suicide prevention? Because I know that that's what a lot of kids, where they get depressed, is the bullying.
Thank you for those questions. As far as the gun locks, I'm not familiar with that initiative and what happened as far as the school board and putting it on the website. So I'm not sure who you spoke to. You may want to follow up with them just to see. As far as anti-bullying, well, we just kind of work with students. Our goal is to just have an overall kind of wellness perspective for students, help build their resilience. So in all areas, we don't only focus on bullying, we focus on having that mental stability, having the ability to navigate any issue that may come up in life. So our overall focus is kind of resiliency.
Thank you.
Thank you.
And then Beth Wiegard has a question for Barbara.
Yeah, hey Barbara. So you mentioned that BSO and I think other police departments will temporarily hold firearms for someone. Does the person have to reach out to that law enforcement entity and say, can you take my guns, or can a family member reach out? Like, what's that process?
I don't really know. I mean, I've just called and asked them if there was a crisis, would you hold a firearm for someone? And they said yes. I mean, they weren't very specific, but it would be good to get that process. In fact, in other states, they actually have maps where they tell you where you can, store a gun in a crisis. And some of them involve gun stores.
Yeah.
Involve the police. And in other states, you can actually put yourself on the do not buy list. If you're feeling suicidal or in a crisis, you can put yourself on the do not buy list. And then that's supposed to prohibit any gun store from selling you a gun. So that's a nice thing too. The other thing that saves lives that I meant to mention was waiting periods. Other states, well, we do have a 3-day waiting period, but waiting periods actually do reduce the number of gun suicides. Because like I said, it's an impulsive decision. And if you have to wait 3 days to get a gun, by then perhaps you've gotten some help or whatever. And I don't know if no one's mentioned this, but I had been to another seminar when they were dealing with just youth. And they said that there's an app called Not Okay, which is an app where you can, program in your emergency numbers. And sometimes they said you're so depressed as a teen or whatever that maybe you just don't even have the wherewithal to call someone, and you can just it's like a digital panic button, and it reaches out to the people that can help you, or your loved ones and your friends. The app is just called Not Okay, and it's just something to, every tool available is a good thing to know about, and I've heard good things about it, and I just wanted to mention it. So
yeah, can I add a word of caution about because we have had with Barbara with those conversations with the police that people shouldn't just show up at a police station with a gun in their hand to turn in, because they get a little freaked out when someone approaches a police station with a gun in their hand. So calling first and just saying, hey, this is going on, and I would feel safer if the gun wasn't in the house. Most police departments will respond to that. Even if it's informally, they'll respond to that.
That's a very good point. The other thing I want to put out is that there's a few gun buybacks going on. Miramar's having one in January. Hollywood's having one in January, and when we get invited to them and we go, we also hand out gun locks and say, do you have other guns at home? Do you know anyone who has a gun that's unlocked? Here's your gun lock. Okay.
I had one quick comment too about this with law enforcement, that one of the barriers for people reaching out sometimes is if they don't know who to contact, that's not an emergency number. We've all heard stories about armed police officers responding to a mental health crisis and with terrible consequences, and people are thinking that. So that's another barrier to that. If there's not an obvious a person or office to contact if you're concerned, that you're not going to have that happen. So people aren't going to call 911 if they don't know who else to call, then they just won't reach out.
Mm-hmm.
Okay. Thank you. So what I'm going to do right now is I'm going to stop recording in case that is inhibiting you from asking questions. Okay, so I'm going to stop the recording.